to, first of all, understand what we mean by gender. It's not just the sexes, but it's also the socialization of the different sexes, male, female, gender. So I think in an African perspective, usually there's certain perceptions about health system and healthcare seeking behavior. So you find that in most societies, men are very hesitant to go seek healthcare services, and yet females on the other side and children usually seek healthcare services a bit more. So in designing health systems for any country, I think it's imperative to put into perspective and take into consideration the fact that why do certain people in the community, why are they hesitant to seek health services? Clearly there's need to interrogate that and break it down also further to not just male, female, but also the different categorizations. I think, for instance, if you're looking at the younger people, there's the children will seek health care much easier than the adolescents. And why is that? If you interrogate that, I think then it will inform how we design our health systems better. First of all, it's seeing a collection of gender specialists in the room, but not just the specialists, the fact that they are speaking and sharing their findings with policymakers. So we had the Ministry of Health, we had the Gender and Inclusion Committee Chair. So that's important. We're speaking to the right people. So it's the specialists speaking to the right people who are the policymakers. And so I feel very strongly that this meeting is going to lead into a better gender-informed policy-making process in the health system in Kenya. And not just in Kenya, but even the people who came from, say, Uganda, the people who came from Nigeria, I think they all feel the same, that the fact that Kenya is bringing policymakers onto the table and they are listening to the specialists. It also gives us hope from other countries that this is something we can do, and it's a journey that Kenya has started that is going to inform how we shape health systems in the country. We have to be sensitive to not just the gender perspective, but also when we design the policy, we should design it with a gender lens. Look at the different aspects. How are the different stratas of society, how are they affected by the systems, how are they affected by the policy? But then also importantly, I think as mentioned by, I think she's called Dr. Joyce Malin, she did say it's not enough to have the policies. It's important that we implement the policies by having processes and procedures at facility level that enable us implement the policy. So having the policy at national level or county level is not enough. We should break it down, take the policy into processes and procedures that inform practice. And that's the only way we shall change how we design our policies, one, but also how we practice in the health system. This is just one of the avenues. And of course, from the group coming up with better strategies and implementation plans of the policies also is important. So all these processes will inform our health systems policies eventually. And then, of course, that trickles down to the health workers and all the people who are working in the health services, and change practice to incorporate the gender perspective.